Someone fainted. Yuna, someone fainted. Young man, don't help him up recklessly.
Don't let good intentions make things worse.
Kid, these days it's hard to help people up.
Thanks for your kindness, but as a medical student, I can't just do nothing.
I can help you record it, if you need me to.
Yeah, we can all testify for you.
Nice one. I work at People's Hospital. I'll help you.
He's unconscious. Have the driver take us to the nearest hospital.
Okay. Driver, do you know CPR? Yeah, you do CPR, I'll do mouth to mouth.
The carotid pulse is back.
He's alive. He's breathing too. Nice job, kid.
Couldn't have done it without you.
Congratulations, host.
Healing and life-saving system has been successfully.
Current activation level, 56%. Please wait patiently, host. Congratulations,
The healing and life-saving system has been bound.
Activation level, 56%. Please wait patiently, host.
Job hunting's been stressing me out so much lately, I'm even hearing things now.
It's not in your head. The system needs to load. Please wait, host.
Young man, I can tell you've got real professional skills.
When we get to the hospital,
Come with me to take the patient to the ER, just in case anything happens on the way.
Okay.
We owe you today, otherwise, that old lady might have been in danger. Oh, right. Which hospital are you a doctor at?
I don't have a job yet. About to check out the community hospital.
Why not try the People's Hospital?
The People's Hospital is a top-tier hospital. With my qualifications, I wouldn't even get an interview.
This is the video I shot for you today.
Oh. Thanks for the trouble. I didn't expect you to get off with me.
It's fine. About this video, how should I send it to you?
I'll add you as a friend.
I'll send it to you when I get back. Bye.
Then I'll head back first. Leave the rest to the doctor.
All right.
Hey, young man. How can you go to a community clinic? As the director of the People's Hospital, I have to help him.
I wonder what this system actually does. It's loading so slowly.
have you found a job yet?
I plan to check out the community clinic. With my current qualifications, I can't get into a top city hospital at all. What a shame.
With your grades, if you go to grad school,
You'll definitely have a bright future.
I can't help it. You know my family situation. Between graduate school and work, I can only choose work.
Call pause.
Hello, is this Luke Stone?
Yes, this is he.
This is the HR office at People's Hospital. Our emergency department has one opening, with a 6-month probation period. Would you be able to accept that?
Did I submit a resume to People's Hospital?
Can you accept it?
I accept.
Good. Report to Human Resources next Monday.
Got it. What's going on today? First I got the system, then I got hired by People's Hospital. Maybe good people really do get rewarded. It's been a week. This system is almost finished loading. I wonder what surprise it'll bring me.
Dr. Lewis. Dr. Lewis, something happened.
What happened?
The patient in bed 3 admitted this afternoon suddenly has trouble.
Where's Professor Cart?
Dr. Cole is resuscitating another patient in cardiac arrest. Ask you to handle this one.
Me handle it?
Dr. Luke, don't be so surprised. Go take a look.
Alright, let's go.
Dad, please hang in there. Dad, the doctor is coming.
You must hold on. How is the patient doing?
Please, save my dad. Save my dad.
Heart rate 140 per minute. Atrial fibrillation.
Blood oxygen is...
Blood pressure is 190 over 100 millimeters mercury.
Sister Lily.
The patient is in critical condition. Sister Lily, patient is in critical condition.
Please, doctor, please.
Get up first.
Don't work up. Wait outside first.
Don't interfere with our rescue efforts.
Bubbly breathing.
Rattling phlegm sounds. Jugular vein distension. Severe pitting edema in both legs. These are signs of pulmonary edema. Lily, give 0.2 milligrams of Cetalanin now. 20 milligrams of Lasix. Turn up the oxygen flow. Give 1 amp of doxophylline. Bring the ventilator. Get the laryngoscope and intubation.
Okay.
No, won't do. Oxygen saturation is still too low. Dr. Chow still can't come?
Dr. Chow's is critical too. We'll need to wait longer.
We can't wait. Put patient on non-invasive.
Copy that. Dr. Liu, you're amazing. Most doctors on duty couldn't handle things like you could.
As long as the patient is stable. We'll talk more when Dr. Chow gets here. It's ventricular fibrillation. It's ventricular fibrillation. If we don't treat it now, the patient could die. Quick, get the defibrillator ready.
Okay.
Charge to 200 joules. First shock, 200 joules.
$38.6
The rhythm is back.
Another problem. Even though their heartbeat is back, their blood oxygen level is dropping again.
Dr. Cole can't get over here. Dr. Luke, what to do?
Now, only one option, use an invasive ventilator. But I've never operated one myself. If anything goes wrong, it's beyond my control. What should I do?
Loaded to 100%. The life-saving system has been activated.
Congratulations.
Patient's low-frequency survival emotions have been collected. Reward, host energy plus 10. Plus 10.
The system's first form can now activate.
System detected host's first emotional energy collection. Rewarding the host with a gift. Activate now. Gift pack.
Giving the host 1 gift pack.
Activate now. Hope you don't let me down, so I can save him.
Received 1 active skill card and 1 system surgery simulation space. Gift pack opened successfully. Congratulations, host. You have received 1 active skill card and 1 simulated
The host may choose
1 surgical skill to learn, wound cleaning, dressing,
Perfect timing. I choose intubation.
endotracheal intubation acquired. Host has mastered endotracheal intubation. Since reward is 1 hour of simulated surgery training.
simulated.
Does the host want to enter the simulated surgery space to train?
Enter simulated surgery.
Does entering the simulated surgery space stop time in the real world?
Practice. This is the simulation space. This system is kind of terrifying.
1 hour in simulated time.
From lowest to highest, the skill levels are.
The timer starts now. Use your time well for surgical simulation and improve your professional skill level.
With a simulation space like this, I can master endotracheal intubation fast. Then even if Professor Cole doesn't come back, I can still save the patient.
The host used
Surgery failed. Simulate.
grade F-.
Surgery failed. Simulation over. Round gets an F dash.
Again.
Host's movements were not up to standard. Grade F-. Patient's F dash.
Grade F-. Surgery failed. Simulation over. Final grade F.
Grade F-. Try again. Again.
The tube went in too deep and entered the bronchus, causing hypoxia and 1 lung to collapse.
Complications arose. The procedure
Simulation
Again.
final grade F. Surgery failed.
Again.
the surgery
Again.
the surg
Again.
the sur the sur the op
Again.
Host intubation successful.
the operation was a success.
Grade A. Simulation over.
Grade
I finally made it to an A this time. Now the patient's intubation should be no problem.
Dr. Lewis. Dr. Lewis.
Oh,
What should we do?
prepare to intubate. I'll do the surgery.
What? Dr. Lewis, this is an invasive ventilator. Are you sure you handle it? Maybe wait for Dr. Carter.
We can't wait. We can wait. But the patient can't.
Dr. Lewis, still too young. In cases like this, most doctors wouldn't dare step in easily. One small mistake could cause complications. Why won't listen?
It's okay, Lily. I practiced this many times.
No, that still won't do. Practicing and intubating a patient are 2 different things. Congratulations, host. Successfully helped a patient. You're done already?
Yes, Sister Lily. The invasive ventilator connected now. The patient's blood oxygen saturation is back up now. The crisis is over.
Congratulations, host. You gained 1 patient's high-frequency gratitude and Sue Lily's admiration. Gained 20 energy points.
Positive emotions are high-frequency emotions. The energy reward is higher too.
Where's the patient who needs intubation? Where's the patient who needs intubation?
Here.
I remember this patient didn't have an endotracheal tube before. Who did this?
Dr. Cole. Dr. Luke did it. If I hadn't seen it, I wouldn't believe someone so young could do it so skillfully. Before I could react, he was already done.
Nonsense. Luke, nice intubation job. I've studied it before.
I've practiced it a few times.
Not bad, you reacted very quickly. I just checked on the patient's condition. If you'd waited for me to do it, something might have gone wrong.
In that situation, I couldn't do much. If Dr. Cole had done it, it might have been better.
Haha,
First people's
you did an excellent job already. Even if I'd done it myself, I could only have managed this much. The patient's condition. Yunhua First People's Hospital. He's stable now. Keep a close eye on him. Oh, right. Go to the observation room in a bit. Handle the patients under observation. I'll take care of the critical patient first.
Okay, Dr. Chow. Haha.
I'll head out first too. Congratulations, host. Collected Chao Tianhui's high-frequency appreciation emotion and gained 10 energy points. 40 now. Getting closer to unlocking the system's first form.
I wonder what surprises the first form will bring me. Your condition is basically stable now. Get plenty of rest. If anything else comes up, tell the nurse directly.
Hey, doctor, my 4 is done. Can I go home now?
See your medical chart.
Doctor, no need to look. I fell off my bike. If my mom wasn't worried, I wouldn't have come to hospital.
Where's your CT scan? Let me see the results.
A CT scan? Why would I need one? I just scraped my hand, and you're making me get a CT and stay for observation? Hey, if I have to stay here for the night? You're making me get a CT and stay for observation. If I have to stay here for the night, are you going to have me do this test, then that test?
Oh,
So you can pocket some kickbacks in between, right? Kickbacks?
You're not fit to be doctor.
Exactly. You have no medical ethics. We ran into Dr. Black.
hey.
The host collected a patient's low-level disgust and gained 1 energy point.
On first night shift, and this happens. No wonder they say.
The ER is where doctor-patient relations are the most tense.
Please calm down. We're trying to keep you safe.
Looks like you're trying every trick to squeeze money out of me. Am I right, everyone? No medical ethics at all. Exactly.
He doesn't deserve to be doctor, taking kickbacks.
I can't believe he's that kind of person. Humph. Dr. Reed, don't be rash. This in the ER happens all the time.
It's fine. I can handle it. 10. This patient. We're trying to keep you safe. If you insist on leaving, sign the chart and write refusing observation. You'll be responsible for outcomes.
Why should I sign it? Crazy? Oh, come on, you're not.
You're responsible for your health. Even if I wanted to help, I can't do much. Good luck. I hope your liver wasn't damaged. Lily. We should report this to Teacher Cole and have him file it so it doesn't affect us later. And please take care of this report too.
Okay.
Your condition is stable now. There's no problem. Be extra careful when you spray pesticides from now on.
Oh, okay.
It's not skin contact that's risky. Contact with the respiratory mucosa can be risky.
Oh, thank you, doctor.
Congratulations, host. You gained patient's strong gratitude and 10 energy points.
There are still more good people around. I wonder about that patient from earlier.
How are they doing now? Lou, come with me now. A patient with an acute abdomen just came in.
Acute abdomen? Could it be that earlier patient?
Help me, doctor. The pain is killing me.
Dr. Keene, the patient left less than half an hour ago. Based on his earlier records, I suspect internal organ damage. Like a ruptured liver.
Luke, take the patient's blood pressure. Lily, call the CT room. Get ready for an abdominal.
Okay.
Doctor, you have to save me, doctor. Before I.
Don't be nervous. We're helping find what's causing it. As long as cooperate with the treatment, you'll be fine.
Host collected a patient's low-level regret emotion. Reward 1 energy point. Host collected a patient's low-level regret emotion. Reward 1 energy point.
Sigh. Professor Chow, patient's blood pressure is low. Risk of shock.
Dr. Chow, the CT room is ready.
Okay, I'll head over right away. Prep the CT.
Okay. Hello? Dr. Cole, the patient has a ruptured liver and heavy internal bleeding. I suggest we take the patient straight to the operating room. Let's not waste any time.
Right, no time to waste. Back to the ER. You and Susan Lee, take the patient to the operating room first. I'll go talk to the patient's family about the surgery.
Got it. Take the patient straight to the emergency operating room.
Okay.
Luke, get changed. You're assisting me on this surgery.
Huh? Me, in the OR?
The assistant couldn't make it today. You'll help me. Any problem with that?
No problem.
Get changed and come with me. Old Will, how's the anesthesia going? Induction is going very smooth.
Surgery is possible. Why bring a new assistant today?
Oh, he's the new doctor in our department. We can't find Chester Brown anywhere right now, so I brought him to learn.
Then you'll have to spend more energy today.
Liver rupture repair is a level 4 difficulty surgery.
A rookie won't be much help to you.
Oh, the young guy's not convinced, huh? Cut the chatter. Keep an eye on the monitor and watch the patient's vital signs. Let's begin the operation.
Got it. Wait, that's not right. Bad, old Chow. The patient's blood pressure is...
The liver rupture is extensive. There's too much blood loss. Jiaolu, suction the pooled blood and keep an eye on the bleeding site.
Got it.
How's old Wu doing?
Not good.
We can't keep the blood pressure up right now.
It's still dropping. Old Chow, nothing's gone wrong, has it?
Shalu, keep looking for the bleeding point. I'll clamp the hepatic artery and the portal vein first.
Got it.
How's old Wu doing?
Not good. Blood pressure is still dropping.
If this keeps up, he'll be in danger. Little Lu, wipe the sweat.
Professor Chow, I can't move my hands right now.
Hey,
You're new here. Not only are you no help, you're just making things worse.
Huh?
Alright, Old Chow, the patient's blood pressure is starting to rise.
Is it okay now?
Dr. Cole, I think I pressed on the bleeding spot in the patient's liver.
You did it by hand? Impressive, kid. Didn't expect that from you. I misjudged you.
Little Lu, keep pressing. You have to hold on. We'll talk after I finish the surgery.
Got it.
Thank you, doctor. Thank you so much. If it weren't for you, who knows what would have happened to my boy.
Haha, you're too kind. It's all part of our job. As the family, just take good care of the patient. Let's go. Lou, we really owe you today. Otherwise, this surgery could have gone wrong.
Yeah, I used to look down on Lou a little, but now I see I was wrong. He's way better than that kid Ching Pang. That kid's a pathetic little sucker. All he thinks about every day is women.
I just got lucky, that's all.
That still proves your fundamentals are solid. And being able to make a quick call on the spot is an essential quality for any doctor.
Lou, old Chow is right. Don't be modest.
Thank you, Professor Chow and Professor Wu.
Congratulations, host. You've collected intense praise from Cecil Skybright and Walter Rush. Reward, 40 energy points.
40 points just like that? With the 52 from before. Doesn't that mean my system is about to unlock its first form? Man, after running around all day, I'm beat. There won't be too many surgeries like this. And I even got a little bonus today. I got approval from Professor Chow and Professor Wu. Maybe I can even become first assistant. Then Mom and Dad can finally stop worrying. The only downside is I'm still 8 energy points short. Sigh, looks like I'll have to wait until tonight.
Congratulations, host. You have collected Tao Li's high-frequency, high-level gratitude emotion.
Tao Li is awake. And he sent high-level gratitude emotion, so that means I can unlock the first form of my system.
Host meets conditions for unlocking the first form. Unlock now?
Unlock.
Congratulations, host. The system's first form has activated, and new features are unlocked.
What features?
The player spends 100 energy points to learn how critical a patient's condition is. Second, the system store is open. The host can spend energy points in simulated time to exchange for professional skills, surgical skills, and equipment. Also, when the host buys a skill card for the first time, the system will grant matching simulated time based on the card's level. Third, the host can spend energy points to buy surgical simulation time directly. Host has met requirements to activate vascular tendon suturing.
So as long as I save up enough energy, I can master every surgery? Seems like no one's ever done that.
A scalpel costs 1,000 energy points.
Even a scalpel is this expensive, so professional surgical skills must cost even more.
System first form reward pack activated. Host unlocked the system's first form and received one
Open it.
pack. You received one random professional surgical skill card.
Open it. Open it. Hope I get a good skill.
Surgery time, and 1 hour of simulated surgery time. Enter the simulated surgery training space.
Why is it just wound cleaning and suturing? I thought I'd get some advanced skill or something. Forget it. Better than nothing. With wound cleaning and suturing, I can get on my feet in the ER pretty fast. And find place in emergency surgery. Enter the surgical simulation space.
Surgery time.
Even though time in the simulation space doesn't pass in the real world, it really drains your mind. I actually slept for 6 hours. Wow, but that's okay. My wound cleaning and suturing has reached level C, so in the ER, I can handle some routine procedures now.
Text back Shirley. Text back Shirley. Swipe to answer.
Hello, is this Luke?
Lily, it's me. What's wrong?
There was a chain reaction crash downtown. Many people are hurt. Our hospital is the closest to the scene, so patients are being sent. The department is swamped. The director wants everyone off duty back.
Okay, I'm on my way.
Doctor, when will it be my turn? Doctor, ow, doctor, ow. Doctor, it's that serious?
Looks like this accident was a big one. Dr. Cole.
Luke Ann, get changed quick. Come give me a hand.
Okay.
I heard you assisted Dr. Cole in surgery last night.
I was helping out. Dr. Cole did most of the operation.
Really? Then why was Dr. Cole praising you, saying you did a great job? Keep it up, kid. Try to stay in our department a little longer.
Sounds like you're taking a jab at me. But sorry. I might disappoint you next.
Be careful, his injuries are serious. Send him to general surgery and schedule an operation. Oh right, and that one just now too. The initial diagnosis shows internal injuries. Get him to the ER now for surgery.
Dr. Chow.
Luan, I can handle things here for now. So you and Chung Peng go help out in the wound treatment room.
Okay, Dr. Chow.
Don't worry, for patients with external injuries, just clean and stitch wounds if possible. If you run into anything you can't handle, have a nurse get me.
Okay. I just learned wound cleaning and stitching, and now I actually get to use it.
Let me take a look, okay? Luke, help clean and stitch this patient's wound. Going to check on the other patients. Kiddo, I'll come back and see you in a bit, okay?
So he left me the tough one. Come on, kiddo, let me take a look.
Sweetheart, let me see.
Mom, it hurts.
Be good. Once the doctor checks your wound, we can go home.
I don't want to. Doctors hurt a lot.
Kiddo, want to play with this?
Really?
You can touch it for a bit. But after that, you have to let me see your wound, okay?
I'll
put it on you, okay? Alright. Take this.
Mom, let me listen for you.
Okay.
It's not too serious. Once stitched up, it should heal in a few days. I'll stitch her up now.
Dr. Lewis, when you stitch it up, can you keep the scar as small as possible?
Ma'am, a wound like this will leave a scar. It's only a matter of severity.
But the child is so young. And you're still so young. What if?
How about this? If you're worried about me, I'll ask my supervising doctor to operate on the baby.
Sure, then we'll trouble Dr. Luke.
Alright, I'll go get him now.
Okay, thank you.
Hey, Dr. Chase. Don't bully the new doctor in the department.
I wouldn't call this bullying. I'm giving him a chance. He's new. He must do it himself. Otherwise, he'll never learn. Right?
But there are so many patients, and quite a few are in serious condition. You're really okay with him handling it all by himself?
His legs are his own. If he can't handle it, he'll definitely come to me.
Dr. Chase.
Speak of the devil.
And there he is. What is it? You came running back this fast? What a man.
Dr. Chase, the girl in the debridement room needs you for the sutures.
That little girl's wound isn't very deep. I can't handle it.
Patient's family has high expectations for surgery. We need a senior doctor to perform it.
I see, so they think I'm not good enough. What a hard life I have. The more capable you are, the more responsibility you carry.
Go on, hurry up.
Luke, and come in with me later. Remember to watch how I do it carefully.
Aw.
You cleaned and debrided this? Didn't expect kid to have skills. That debridement was clean. Doesn't seem like a rookie. I was hoping to find some fault with it, but now I can't.
Dr. Stone, please start. There are still a lot of patients waiting outside.
So? Learn something?
That technique wasn't all that great. If this is the attending's level, doesn't that make my skills better than the attending doctor? Dr. Chase, your stitching is really good. I should learn from it.
Good that you know. After you get home, don't let the wound get wet. Come back in a week to have the stitches removed.
Thank you, Dr. Chase.
Alright, stop standing around. Take care of this patient's follow-up, then go handle the next one. If you can't deal with it, come to me.
If I stitch it up, it'll still leave a scar. But it'll be way better than Chase's. Too bad these parents are just too biased.
Thank you, Dr. Luke. This is for you.
No need to thank me.
Thanks, Dr. Luke. We'll get going.
Don't let it get wet.
Got it. Bye.
Bye.
Bro.
Let me rinse the wound with iodine first so it doesn't get infected later. But the iodine might sting a little. Bear with it.
Okay. Don't worry. I'm this old already. I can handle a little pain. Go ahead.
All right. Bro, relax. If it hurts too much, just scream.
No, keep going. No, leave me alone.
All right, then I'll keep going.
MM.
Bro, it's stitched up, but the cut is pretty deep. You still need a tetanus shot.
Ha ha ha. Your stitches actually look pretty good. You can tell it took a steady hand. Hey, kid. You look pretty young. But you've got skills. Ha ha ha.
Our hospital's pretty solid.
Don't fool me. A few months ago, I hurt my arm. One of your doctors here, a fat guy named Chester, stitched me up. Half a month after I got back, the wound hadn't healed. I returned for a checkup, and guess what? It got infected. No choice but to stitch it up again. If you don't believe me, look at this scar on my arm.
That fat guy named Cheng. Could it be Chester Bird? Looks like Chester Bird isn't very good at this after all.
Bro.
Don't worry this time. It won't happen again. Oh, right. After you get back, make sure this wound doesn't get wet. And don't put any weight on it. In 7 to 10 days, come find us, and we'll take the stitches out.
Alright, ha ha ha, thanks.
Little Luke, is the debridement done? If you can't handle it, I can do the sutures.
You've got some nerve saying someone else can't handle it.
And this is.
You forgot me that fast? Then do you remember this scar?
So it's you. Come out with me for a second. This patient is really tough to deal with. Be careful. If you can't handle it, go find Professor Carl.
Professor Chase already finished suturing the patient.
You already stitched him up. Who told you to do that? You're in trouble now. If anything happens, you're on your own. I'm going to see the director right now.
Are you crazy? You stitched him up and that's still a problem?
Oh, come on. He's just scared I'll make trouble. No real skill at all. Such a scaredy cat. And this kind of person is a doctor? What a tragedy for us patients.
Please don't be upset. I'll write you an order. Just get a tetanus shot and you can go home. Easy, slowly.
Director Reed, this is bad. The ER chief who came to our department.
The patient from the ER chief's case is back. Back again. Which patient?
The one with the infected wound. The one who had a second suturing procedure and was left with a scar on his hand.
It was you who didn't clean the wound properly and botched the stitches. Didn't we settle this last time? Why are you here again?
Director Luke, that's exactly why I came to see you. This patient got hurt again, and in our department. A young doctor stitched him up himself. He's never done it before. I was worried he'd bring trouble to our department. So I came to find you right away.
The new doctor? Who is it?
Luke Peace.
First people.
If I say his name, you still won't know who. You know, that college graduate. You must know who I mean, right?
Yeah, I know him. He'd only been at the hospital a few days, and without his supervisor's approval, he actually dared to operate on a patient and do the suturing himself.
Oh, I had no idea. I told him to come get me whenever there was a suturing case. Who knew he'd just do it himself?
So what's the situation now? Was his stitching really that bad?
Of course it was. You have no idea. I went to the department, and that patient looked awful when he saw me. Rolling up his sleeves like about to hit someone.
Take me over there. Come on, let's go.
Hello, your medicine. Thanks.
He's over there.
Wait a second. What? I haven't even come after you yet, and you still dare block me?
Sir, don't get worked up just yet. If you have a problem, tell me directly.
I'm fine. I just got hurt and came to get stitched up. Hey, what's wrong? So I can't come to you for stitches now, is that it?
Director Reed, I'll go get Luke over here. This is all Luke's fault. I'm going.
Hey, Master Zhang, can I take a look at your wound? Ow.
Ouch.
That's enough. When you get home, keep the wound dry, don't strain it, and come back to get the stitches out when it's time.
Okay. Thank you, doctor.
Hey. You still have the nerve to stitch people up here? I'm telling you. You're in serious trouble.
Mr. Chang, calm down. We can talk it through.
Talk it through? Who told you to stitch up that patient earlier? Did you get my permission?
Professor Chang, you said not to come to you unless it was important. Now I'm handling it myself, and that's somehow my fault?
You can handle it. Handle what? If you could handle it, I wouldn't be here. Let's go see Director Luke. You caused this mess, so you deal with it. Don't drag us in.
No need. We're here.
Director Luke.
Bro, why did you come here again? Given your condition, you need to move less.
It's okay. I saw someone was giving you trouble, so I came over to explain. Don't be scared. I'm not here to cause trouble. Dr. Luke's medical skills are way better than yours. The wound he stitched up was neat and looked great. How could I be here to cause trouble?
No way. He's new here and only has a bachelor's degree. He hasn't had hands-on experience. How could he be good at stitching wounds?
Enough, Charlie. I saw this man's wound being stitched with my own eyes. Landon's suturing skills. You're way better than him. Compared to him, you're not even in the same league. I'm seriously wondering if there's a major operation. Can you even handle it?
Chief, I might just be too tired lately.
Tired? Fine. For the next month, you won't be doing any emergency surgeries. Get some rest.
No, Chief. If I stop operating, there'll be no one left in our team. Won't that hold up the patients?
Humph, you're just the first assistant, not the lead surgeon. It's not like we can't do surgery without you. Besides, isn't Little Lou still here? With his suturing skills, he's fully capable of being the assistant. Little Lou, starting today, you're the first assistant. If you do well, we can consider making you full-time early.
I'm the first assistant now?
Oh wow, congrats, Dr. Lou. Ha ha ha. From now on, if I get any bumps or bruises, I won't have to worry about quacks anymore.
Thanks, bro.
I'll get going then. You go ahead and get back to work.
Humph. You're pretty pleased with yourself, huh? This is all because of you. How could I end up getting punished?
Professor Chang. You're who went to Director Luke. And you're the one who stirred up trouble too. Director Luke took you down. I didn't do anything. And from start to finish, you've been the one holding a grudge against me. I didn't do anything, did I? You told me not to bother you. So I handled it. I'm a doctor. If I operate on a patient and they're satisfied, how is that my fault?
Don't get cocky. Joan, you're just a bachelor's grad. I graduated from Crimson Medical University. You're way out of your league if you want to fight me. Even if you become first assistant. Just 1 month. After a month, you're still out.
If I do well, it won't stop at 1 month.
Congrats, host. You collected high-frequency shock from the patient, low-frequency disgust from Charles Roche, and high-frequency gratitude. Total reward, 170 energy points. Total, 183 points.
183 points. I can trade that for an hour of surgical simulation. That should bump my wound cleaning and suturing skill up another level. System, exchange 100 energy points for 1 hour of wound cleaning and suturing simulation.
Congrats, host. Wound cleaning and suturing skill reached B+. Keep it up.
1 hour and I made it to B+. Another half hour, and I should hit grade A. Just thinking about it makes me happy. That's great.
What good news you thinking about? You look spaced out.
Nothing. I spent all day doing wound cleaning and suturing. Feels like my skills have improved again.
If you hadn't said that, I would have forgotten. Kid, you quietly pulled off something big today. How'd you suddenly become first assistant without a word?
Just got lucky.
Fine, don't tell me then. Even if you didn't say, I'd know. You've definitely got someone behind you. Otherwise, with your education, getting into the hospital would be a miracle, let alone in just a few days. Becoming first assistant. Your connections must run pretty deep.
No, Lily, you're overthinking it. I don't have any connections. Today was completely Chang Peng bringing it on himself. I'm telling you, patient originally came to see Chang Peng today. I stepped in to help him, and he blamed me. Pigsy not knowing a good person's heart. Then when Director Lu showed up, he had it coming. But what happened today was totally his own fault.
I see. Still, that's because you're capable.
Dr. Chow.
Lou, you must be exhausted. You did great today. The director has promoted you to first assistant. From now on, you can scrub in with me.
Thank you, Dr. Chow. I'd like to learn from you.
All right, go get some rest. Don't worry about the department stuff. Just come in for the day shift tomorrow.
The head nurse found out someone used cosmetic sutures. She's asking about it in the doctor's office and told me to come let you know.
Cosmetic sutures? Could she be talking about me? But what I did for the patient was cosmetic tension-reducing suturing.
Isn't it normal to use cosmetic sutures for that?
Everyone's here, right? Who used the cosmetic sutures in debridement and suturing room 2 this afternoon? Don't you know cosmetic sutures cost a lot more than regular ones?
Debridement and suturing room 2. So this is my fault then.
Little Luke, could it be you used the wrong one? If it was you, just say it. It's okay.
This afternoon, in debridement and suturing room 2, it was Lucas Reed using it the whole time. If there was a problem, then it had to be, kid. You thought dumb luck could compete with me? Let's see how you explain this now. This position can only be mine.
Was it him? No way.
You were the one using the cosmetic sutures this afternoon.
Was it him? No way.
You used the cosmetic sutures this afternoon. You're new, so I'll let it slide this time. Be more careful from now on. Don't use the wrong one again.
Head nurse. I did use the cosmetic sutures, but I didn't use the wrong one, did I?
The cosmetic sutures are kept in the back of the cabinet. If it wasn't a mistake, then did you do it on purpose?
Looks like some people are just making excuses. People like that really make you question their medical ethics.
Head nurse. Can I use cosmetic sutures when I do a cosmetic tension relief closure for a patient? This afternoon, I had a patient with very high standards for stitching, so I did a cosmetic tension relief closure for her. That's not wrong, is it?
What? You did the cosmetic tension relief closure? I thought Dr. Cole did it. Looks like our Dr. Luke was hiding his talent.
Who is this guy? How is he so
Congratulations, host. You've won strong praise and shock from the doctors and nurses in the office. Plus low-level jealousy and suspicion. Total reward 82 energy points. Your current balance is 165 points.
I didn't expect one little misunderstanding to bring me this much energy. That's worth half a day of work for me.
Lewin said you can do tension-free suturing?
Yes, sister you.
You say you can, so you can. As a doctor, not even thinking about proficiency and just saying you can. That's just reckless.
Teacher Chang is right. Saying you can when you're not skilled enough is an insult to medicine. That is reckless.
You all heard that, right? Even he said so himself.
Teacher Chang, don't get worked up. I said you were right, but I never said I can't do it. I'm confident in myself. I can handle it skillfully. No mistakes. I could already manage it easily at my previous level, let alone now that I've reached B+. There definitely won't be any problem.
No way. You're just a newcomer and only an undergrad. How could you possibly know how? Aesthetic tension reducing suturing, only Professor Chow has mastered that technique. Could it be?
Oh, that has nothing to do with me. Little Lou, you learned this aesthetic tension reducing suturing during your internship too, right? Good. When there's a chance, I'd like to see how skilled you are and exchange pointers.
Thank you, Professor Chow. It's an honor to learn from you.
All right, this ends here. We've all had a long day. Go back and get some rest. Oh, right. Come in early tomorrow and do rounds with me.
Okay, Professor Chow.
Lewin, if I let you off easy, then I'm not Cheng Peng.
Need to make time to get a place. Where I live now is still too far from the hospital.
Sir, do you need help? Lewin, alumni dean student. Lewin.
Warwick.
Are you interviewing at the hospital?
No, I already work at the City People's Hospital, but I'm still temporary staff, so it's not very stable yet. I was gonna tell you after things settled. Didn't expect to run into you here.
We're brothers. Stop putting on a brave face. With your education, could you really work here?
I'm not lying. If you don't believe me, go take a look.
With your education, could you work here?
I'm not lying. If you don't believe me, go look. My photo is hanging in the ER right now.
You serious?
Yeah. See, that's my photo. Believe me now?
I hadn't heard you had relatives at the City People's Hospital. How'd you get in?
I don't know either. Maybe good people get good luck.
No matter what, it's a good thing. Now that you're at the People's Hospital, we can look out for each other.
From now on, I'll be counting on you. You're the dean's student, and I'm just a temp. I might get cut in next month's evaluation.
You'll be fine. Back in school, you were always in the top 10 of your grade. I'm sure you'll stay.
Thanks for the good luck.
Lucan. I was wondering why you weren't here yet. Go change, we're about to
Lily, I'll go change now.
hum.
Head to work first. Chat next time.
Okay.
My habit on rounds is to ask questions. This is a patient with chest pain. So, who wants to explain how to make a differential diagnosis for chest pain? Gold Kimson, you go first.
Based on severity and urgency, the critical ones mainly include acute myocardial infarction and aortic dissection, pulmonary embolism, tension pneumothorax, and then intercostal neuralgia, costochondritis, shingles, and so on. So how do you tell these conditions apart?
What, you can't even handle such a basic differential diagnosis?
Professor Cole, these can all be checked with tests.
But what if you're not in a hospital right now, without any medical resources? Then you can't do anything at all? Luca, you just graduated too, right? Age-wise, you're about the same age as Henry. Tell us how to make the differential diagnosis.
You can tell these diseases apart from the symptoms, physical signs, and supporting tests, like an acute myocardial infarction. It usually causes crushing pain in the precordial and substernal area, along with sweating. The ECG shows marked ST changes, and cardiac enzymes are elevated.
Go on. Lucian explained it well. Chest pain is something we see all the time in the ER. We deal with lots of cases every day. Before treatment, figuring out exactly what disease it is especially important. I hope you all learn more from Lucian and build a solid foundation.
What's so great about that? It's just dead knowledge from books. A patient just came into...
Which team is taking the patient? Hurry up. A patient arrived in the ER. Which team is taking them? Hurry.
Chung Rock, get to the ER and check on the patient now. I'll take the others and keep doing rounds.
Okay.
You go with him.
Dr. Kale, I can handle it on my own.
Chung Rock, I'm the senior attending physician here.
Got it, Dr. Kale.
Relation to the patient?
Oh, I'm the patient's daughter.
When did this start? What exactly were his symptoms?
He started having chest pain and dizziness last night, and he still hasn't gotten better. Look.
Then why was he only brought in now?
I told him to come last night, but he insisted he was fine and that some rest would do it. He just wouldn't come. Look at him now, oh dear.
I understand. Please don't worry. Tell me about the patient's previous health condition.
Okay.
Dr. Chase. History of coronary artery disease and coronary artery disease, high blood pressure, and multiple vascular narrowings. He hasn't had a heart stent before and also hasn't been taking medication regularly.
Okay, keep an eye on the ECG changes.
Dr. Chang. This patient has a right bundle branch block.
When he had ECGs before, did any doctor ever mention this condition?
Before, they just said there was a little myocardial ischemia. Nobody mentioned that right bundle block you said. This, how?
Based on the patient's symptoms, plus this newly developed right bundle branch block. And the patient's medical history too. I can pretty much confirm it now. The patient is having an acute myocardial infarction, Lily. Get a D-dimer test ready. Call in a cardiology specialist for an emergency consult and prepare to discuss coronary angiography.
Okay.
Xingpeng's judgment isn't wrong, but why does all of this feel a little too obvious? I just keep feeling that underneath all this, there's another problem. The heart rate's a little fast, and the blood pressure's a little low. Dr. Chang, I don't think the patient's problem is cardiac. It's definitely not just a simple acute myocardial infarction.
Lewin, we're trying to save a life here. Don't spout nonsense just to show off.
Dr. Chang, it's because we're trying to save a life that I have to speak up and share my opinion.
Can't you read an ECG, or do you not know the patient's history?
Dr. Reed, I'm not denying your opinion. I've seen patients with heart pump failure too, but their symptoms would never be this stable. This patient has a fast heart rate and low blood pressure, but there are no crackles in both lungs and no signs of pulmonary congestion. Based on clinical judgment and the current test results, we can't rule out a pulmonary embolism.
I don't care what you think. I'm the attending physician here, so only my opinion matters. And pulmonary embolism? I could say it's a dissection. List every possible cause of chest pain, to show off in front of me. You're really going all out, aren't you? Young man, learn your textbooks properly before you make clinical diagnoses. You're done here. Go stand aside. President Lewis, you're here.
The chief resident from cardiology called for an emergency consult again. Chief resident from cardiology, what is it? You're not wrong again this time, are you?
President Lewis, don't worry. No misdiagnosis this time. This patient was admitted to your cardiology department before. Compared with the previous ECG, there's now a right bundle branch block again.
So you think the patient has an acute myocardial infarction?
With a right bundle branch block and symptoms like chest pain and tightness, it's most likely an acute myocardial infarction.
Was the D-dimer checked?
I've already sent someone to handle it.
Mr. Lewis.
Aren't you going to arrange the surgery? If we delay this patient by even a minute, it'll be dangerous.
What surgery are you talking about?
And Mr. Lewis, this is acute myocardial infarction. Aren't we doing surgery? Or does the patient have some contraindication?
Who says this has to be a heart attack?
And no, not a heart attack.
Dr. Chase, the D-dimer report is out.
Do you still think it's myocardial infarction now?
Could this be a pulmonary embolism?
You're thinking pretty fast, but a patient with heart pump failure wouldn't look this stable. Those patients usually have severe chest tightness and trouble breathing. Also, that new right bundle branch block you mentioned, besides a heart attack or excessive right heart strain, can also be caused by something like a pulmonary embolism.
That's exactly what Luke said. Does he really know that much?
Don't just stand there. Call the respiratory ER, then call the ultrasound department and have them come do an echocardiogram. Then we can confirm the diagnosis.
Okay.
Doesn't that just prove what I said earlier about pulmonary embolism? I wonder if this doctor noticed it. If I can prove the patient's heart and lung function is fine.
The right heart load is increased. Won't that do it?
Then with evidence in hand, Chester Peng won't keep insisting on his way, right? System. Redeem the basic echocardiography skill card. System. Redeem the basic echocardiography skill card.
Simulation complete. Congratulations, host. Echocardiography skill has advanced to C1.
It took half an hour to get to C-. That was no easy feat. But with current skill level, I should be fine handling some simple procedures. Sir, let me check your heart. Please turn a little to your side. Yes, just like that. Hang in there a little longer. It'll be done very soon.
Since when did the hospital's ultrasound room get so efficient? I just called, and they already sent someone over for an ultrasound.
So the heart function really is fine. Good thing I guessed right.
Then this isn't pump failure from an acute heart attack.
Check the pulmonary artery again. Measure pressure in the pulmonary artery.
Okay.
How's the pulmonary artery?
The pulmonary artery is enlarged, and pressure is elevated, based on patient symptoms and signs. Plus the additional tests and the pulmonary artery ultrasound results. I strongly suspect it's a pulmonary embolism.
I only asked for an ultrasound reading. How come he even gave me a clinical diagnosis? Are young people these days all this good? Cheng Peng, come quick. The echocardiogram results are out.
Mr. Liu, what did you just say? The ultrasound results?
That young guy from the ultrasound department already did the exam. Normal heart function, but widened pulmonary artery and elevated pressure. It points to a pulmonary embolism.
That can't be right, Mr. Liu. The ultrasound doctor hasn't come yet.
There he is, isn't he?
Mr. Liu, I'm not an ultrasound doctor. I'm a new ER doctor. My name is Lucan.
You're the new ER doctor. You're not from ultrasound. How do you know how to use this ultrasound machine?
Professor Lewis, when I was interning in ultrasound before, my instructor taught me some basics, like standard views, heart function, and pulmonary artery exams. I can handle those. Mr. Lewis,
This kid's just messing around. He's the new resident in our department. Don't listen to his nonsense.
Chad, you didn't see it, so how can you say that? I watched Luke Adams do the ultrasound. His technique may not match those old pros, but his skills are definitely solid.
He's really that good? From that cosmetic tension relief suturing before to his ultrasound skills now. Even Mr. Lewis thinks highly of him. If the results really are like he said, then he saved my life today.
Which patient needs an ultrasound?
Dr. Foster, over here.
Aren't you doing the cardiac echo? Why'd you call me over?
Well, we're not specialists. We just took a quick look. For the real results, we still need you experts.
Foster, check it again, please.
All right. Professor Lewis, the patient's heart function is fine, but the pulmonary arteries are clearly enlarged. The flow is slow, and the resistance is high. The pressure in the vessels is very high. Based on these findings, I strongly believe this patient has a pulmonary embolism.
Good thing we didn't go the wrong way. Now the patient can get proper treatment.
Chester, good that I was the one here this time. If it had been any other doctor listening to your nonsense, and the patient's treatment got delayed, could you take the blame?
What
are you standing there for? Where's the pulmonology consult you asked for?
I already called them. They should be here any minute.
The patient probably has a massive pulmonary embolism. Talk to the family about thrombolysis now.
I'll go talk to the patient's family.
Go on. Lou, your echocardiography skills are good. The one with Flora was almost exactly the same. Your clinical thinking is very clear. Just got here and haven't picked a department yet, right? So, want to join our department?
Thank you for thinking highly of me, Dr. Lewis, but for now I want to stay in surgery.
We do procedures in internal medicine too. If you want hands-on experience, you'll have chances here too. How about this? Don't rush your decision. There's plenty of time ahead. If you ever have any thoughts, just come see me.
Thank you, Dr. Lewis.
Hey.
Luke Ann.
Dr. Chase, the patient is on thrombolysis. So far, nothing abnormal. I also combined the opinions from cardiology and pulmonology. A consultation summary. It's all been written down. You can take a look.
Luke Ann, thanks for today. I can see it now. We're not the same kind of people. You're outstanding enough that I'm not even qualified to be jealous of you. So I still need to apologize for my attitude today.
What's wrong with him? He gave in that fast?
Congratulations, host. You've collected Chasepan's low-frequency remorse and high-frequency gratitude. Reward, 11 energy points.
Gratitude.
I get it. If I hadn't stopped him today, his diagnosis would have been wrong. That would have been a medical accident. So in that case, backing down makes perfect sense. Dr. Chester, too kind. It was an academic discussion. Differences of opinion happen.
No matter what, I still have to thank you.
Maybe that's for the best. Otherwise, he'd probably keep targeting me, and that would be really annoying.
Doctor, is my dad okay now?
Yes. The patient is stable right now, and all his vital signs are normal. But I still need to keep observing him.
As he's stable. Thank you, doctor.
Thank you. This is what we're supposed to do. Seeing patients get better is what we want too.
Doctor, this is just a small token of my thanks. I'm leaving my dad's treatment in your hands. Doctor, this is a token of my thanks. Leaving my dad's treatment in your hands.
Ma'am, there's no need for that. We can't accept it.
Doctor, don't worry. Checked. There are no cameras here. Please take it, ma'am.
You don't need to do this. We'll do our best to treat your father anyway. Please keep the money. Use it to buy the old man good food. It'll help him recover faster.
Wow, these days there are still doctors who won't take a red envelope.
High-frequency admiration and shock detected. Congratulations, host. High-frequency admiration and shock High-frequency admiration and shock from Lily Sue, admiration from Fiona Fong, admiration and shock from Luke Liu, and shock and admiration from Thomas Chow. High-frequency admiration and shock. Reward, 7.
No way, really? I didn't take the red envelope and earn respect, plus praise from Teacher Liu. What an unexpected bonus.
Not bad, Dr. Luke. Victor Liu from cardiology thinks highly of you. He even asked Director Luke for you. Teacher Chow can't stop praising you either.
No way, Sister Lily.
Why not? If it weren't for you, Carson Ching might have made a misdiagnosis. That alone makes sense for Victor Liu from cardiology to want you.
Just a coincidence.
You're just too modest. Dr. Chow is here.
Not bad, Xiaolu, I heard. You helped diagnose a case of pulmonary embolism.
Dr. Chow, I just got lucky.
Why be so modest at your age? That wasn't luck. Otherwise, how could Dr. Chung Peng have misdiagnosed it?
Maybe Dr. Chang was just nervous and overlooked a few things.
I heard you can do cardiac ultrasound too. Did you learn that during your internship?
I learned a bit more during internship.
How come I never heard of any hospital in Yunhua City being this nice to interns? No matter how you learned it, it's a good thing, at least in the ER. It means you can help more patients. That pulmonary embolism patient, keep a close eye on them. It'll also help you learn more about the case.
Sir, take this once a day, in the morning.
This one too. Doctor. I'm already feeling better. So do you think I can be discharged?
Sir, your condition is only under control for now. You're not fully recovered yet, and we still need to observe you for a while. Otherwise, the treatment you had before will have been for nothing.
What about tomorrow, then?
Sir, just focus on resting. The policies are good now. With health insurance, it won't cost too much. And besides, if you rush home before you're fully treated, it'll only cause more trouble later.
Dad, I heard you saying outside that you want to leave the hospital. Not this time. This time, you have to get proper treatment. Just listen to Dr. Lewis.
All right.
Dr. Lewis, what are you trying to do?
I was just worried you'd pull something weird, and then I'd really be in trouble.
Dr. Lewis, you got it right. I really did come to bring you something.
This is a thank you banner for me? I only saw others get these. Now I finally have one too. Congratulations. Oh,
You collected extremely high-frequency gratitude from patient's family member. Reward, 100 energy points.
this time it gave me 100 points. Adding in the energy points I had left before, I'm at 240 now. If I save up more, I can trade straight for an advanced wound cleaning and suturing skill card.
Dr. Lewis.
On behalf of our emergency department, I'll accept it. Truly grateful for your kindness.
A healer like you deserves this.
Not bad, Dr. Lewis. You got here and already received a We need to mark this properly. Stand here, I'll take a picture. Later, you can make an album. Just for collecting these photos. Gotta say, your hands are pretty handsome. Dr. Luke, hand.
Dr. Cole called. Bed 4 has abdominal pain. He told you to go there. He'll be here in a minute.
Lily, hold on to the banner. I'll go check right now.
Okay, go on. Hurry. I'll help you in a bit.
Doctor. What illness do I have?
Acute cholecystitis with multiple gallstones. Given your condition, you need surgery to remove it right away.
Doctor. Can I not have surgery before I? The medication you're on has been working pretty well.
But this can't wait anymore. With your condition, it's happening more and more often. If we don't remove it soon, I'm afraid there could be a risk of cancer later on.
Ma'am, where's your family? We need to talk to them about your condition. In a case like this, the sooner you have surgery, the better. Ma'am, Has your family not arrived yet? Ms. Chow, for surgery under general anesthesia, a family member's signature is required. Her family can't make it right now. Do we still need to keep waiting?
If not, let's report it to the medical affairs department first, then contact her family directly. Remember to record it. We can only operate once the patient's family gives consent.
Okay.
It hurts so bad. It really hurts.
Doctor. With the patient acting like this. Could it be? It's perforated.
Come with me. Let's find the director now.
No, we have to wait for the family to arrive.
Director Lucas, report this to medical affairs.
The patient, even if we report it to medical affairs, if something happens, it'll still be on us.
Director, the patient is already showing signs of septic shock. If we don't operate right away, their life could be in danger.
Old Caleb telling me won't help. I want the patient treated as soon as possible too. You know it too. If anything goes wrong, our whole department goes down with it, and the hospital's punishment will fall on me.
But
no buts. Instead of arguing with me here, you should hurry and contact the patient's family. Have them come to the hospital as soon as possible. Maybe then she can get treated sooner.
Director Luke. Doctor, what do we do now? In her condition, she definitely can't wait for the family to get here, and I just checked her chart. She has congenital heart disease. The longer this takes, the greater the risk.
the patient's condition is very serious, but Director Luke does have a point.
Professor, the patient definitely can't wait for the family to get here. The director is worried if something goes wrong, the hospital may be held responsible. Can we ask a higher-up leader for instructions? Let him make the call.
Okay, wait a moment. I'll call President Ian.
I hope things go smoothly on Professor Cole's side. Otherwise, there's really nothing more I can do.
Come with me. Prep for surgery. The patient's condition is complicated right now. There are already signs of shock, so we need to move fast.
Understood.
Right now, the patient has a perforated gallbladder and acute peritonitis, so laparoscopy isn't suitable. We need to do open surgery. Be prepared for that.
Don't worry, I can handle it.
That's strange. He's already been anesthetized.
Why is the patient still breathing on their own? What?
It's okay. If the patient is still breathing on their own, the muscle relaxant may not be enough. I'll give a little more.
Hurry!
How is it possible? The muscle relaxant is already over the normal dose.
Why is the patient still breathing?
Doctor, a normal breathing waveform on the monitor doesn't necessarily mean the patient is breathing on their own. Because I looked at the patient's chart before. The patient's heart function is abnormal. The point of strongest heartbeat has clearly shifted downward. The patient's heart is enlarged. The point of maximal impulse has shifted down. When her heart beats, it moves the lungs, which makes the monitor show a normal breathing waveform.
That makes a lot of sense. But just to be safe, I'll go get the head of anesthesiology to take a look. Chief, could it be because the patient's heart is enlarged? And the point of maximal impulse has shifted, so the heartbeat is driving the pulse movement? Is this the best you could come up with? Didn't see that coming. Anesthesiology department is full of hidden talent. I can't take credit for that. It was Dr. Luke in from the emergency department. The new doctor? You haven't picked a department yet, have you? Choosing surgery is really not worth it. Why not join anesthesiology? I'll make you a full-time doctor right away.
Director Bear, that's not very fair. You're poaching right in front of me.
Your emergency department has plenty of talent. Anesthesiology department is short-handed daily. We're short-staffed every year.
Everyone else is fine. How about I give you Chester Peng? Liam, that's true love.
You'd better keep that weirdo for now. Let's do bedside ultrasound for the patient soon. Once we check the heart, we'll know. Usually, the breathing pattern caused by the heart moving the lungs is false. If nothing's wrong, we can continue the surgery. I won't keep bothering you.
Old Woo. Go check the bedside ultrasound. If everything looks fine, we'll get ready for surgery.
Okay.
Little Lou, You did a great job. In today's surgery, you helped me a lot. You're easier to work with than Chung Peng.
Learning from Professor Chow, I can learn a lot.
Xiao Lu, no need to be modest. Last time I watched you operate, you were still inexperienced. This time, you've got the hang of it. Could it be you're the legendary genius?
All right. The surgery is over. Have the nurse take the patient to rest first. Xiaolu, you're the surgeon. Keep a close eye on the patient's condition. Make sure you pay extra attention. Let's go report our work to Director Luke.
Oh, okay, Teacher Caleb. I'm only getting by because of the system. If it weren't for the simulation space, there's no way I'd be this good.
Congratulations, host. You collected Caleb Skybright's high-frequency admiration emotion and Walter Rush's high-frequency surprise emotion for a total of 20 energy points.
The patient's condition is improving. All symptoms are stable. Also, make sure to tell the patient's families that if the patients have vomiting or bloating. Got it. That's all normal, so don't worry. If nothing gets serious, we can put them on a liquid diet tomorrow.
Okay, got it, Dr. Lucas.
Congratulations, host. Collected high-frequency gratitude emotions from patients and their families. Admiration emotions from the nurses. Total energy gained.
84 points. That much? Added to what you got before. That makes 380 points. In that case, I can buy a premium skill card now.
Luke Ann, I was just looking for you. Come with me for a second. The patient's family wants to see you.
The patient's family wants to see me?
Yeah. I heard this family has a pretty unusual background. Just come with me. You'll see when we get there. Let's go.
Mr. Fong, have some water. Thanks.
Old Chow, didn't expect you to be this lucky. You reporting over my head.
Really pissed me off.
Who would have thought, by sheer luck, you ended up saving the mother of the chairman of Fang Hai Group?
You've really got some skills.
You two finally made it.
Yeah.
Dr. Lewis, Dr. Carter. Dr. Lewis, Dr. Carter, thank you for surgery. You saved my mother from danger.
You're welcome.
I'm not just being polite. I consulted experts before. If you two hadn't pushed through difficulties and taken the risk to operate right away, my mother's condition would have been unimaginable.
You're kind. It's what we should do. Any doctor would have done the same.
Mr. Foster, this time, your mother made it through the danger. That's wonderful news. Any doctor would do the same. It's our duty as doctors. A doctor's heart is kind. It's far more than just words.
Oh, right. Here's my business card. If you two need anything, you can come straight to me.
Director Liu, why do you value him so much? So you're the chairman of a private company.
Besides that, on behalf of the group, I'll donate 1 million yuan worth of medical equipment to our hospital's emergency department.
Oh my. Thank you, Mr. Foster, for sponsoring equipment for us. The ER will be able to help more people from now on.
This will also help our emergency team raise its medical standards and benefit the people in the future.
This is the responsibility of Yunhua City Hospital.
Then, President Foster, Director Reed, if there's nothing else, we'll head out first.
You and Dr. Cole
should head back first. Thanks for your hard work today, both of you. Director Foster, please keep a close eye on my mother's treatment from here on. If there's nothing else on my end, I won't keep bothering you.
All right. Okay, I'll walk you out.
Mr. Foster.
Dr. Lane, I've been waiting here just for you.
Mr. Fong, you don't have to do this. As long as there are patients, I'll do my duty.
Dr. Liu, you're truly a good doctor. It's all my fault. Years in business made me think this way out of habit. I'm so sorry.
You're too kind, Mr. Fong.
Dr. Liu. No matter what. If it weren't for your persistence, my mother's life wouldn't have been saved. So I'm thinking, besides the money I donated to sponsor the hospital, I'd also like to give you a separate sum of money. Take this as my thanks. I need you to accept it.
President Fong, if you do this, then you're not thanking me. Putting me in a tough spot, President Fong. I understand how you feel. But there's no need to do this. Even if the patient today wasn't your mother, but any ordinary person, I would have made the same choice. I'll always be proud of every effort I make to save a patient.
I was too hasty, Dr. Liu. You're such a good doctor. If you need anything later on, you can always come to me.
Okay.
Then I'll take my leave first.
Okay. Goodbye, President Reed. No wonder. Director Shaw and Reed were chatting so eagerly. They're the same kind of people. I heard. Dr. Chow and Director Liu joined the hospital in the same group. With Dr. Chow's personality, he probably wouldn't get along. Dr. Chow, it's obvious.
You really don't like Director Liu. It's not about liking him or not. He likes playing politics. I just want to treat patients and save lives. That's why I've stayed in the ER all this time. Liu, you've got real potential. If possible, I hope you'll put your heart into medicine. As a doctor, medical skill is what matters most.
Professor Chow, I'll learn from you.
Well, it's noon. Let's go eat at the cafeteria together.
Sure, I have some questions to ask you.
Pengjin, come on, let's go together.
Dr. Chow, Dr. Liu, you're both here. Great.
Take your time. What exactly happened?
A restaurant near South Bridge exploded. Many injured people have already been sent to our ER. Please take a look.
What? It looks like this is really serious. We all need to give it everything we've got. Shengpeng, you've got experience. Come with me to the trauma room and assist me. We need to save the critically injured.
Okay, Xiaolu.
Go to the wound treatment and suturing room. You'll handle external injuries. If you run into cases you can't deal with, have a nurse notify me.
Okay.
Lily, go with him. Zhao He, you're assisting them. Check blood pressure and run ECGs. Then do blood gas tests.
Got it.
All right, everyone, go get ready.
Dr. Chow's plan is pretty reasonable. Right now, the only thing I'm really good at is wound debridement and suturing. I need to polish it a bit more. System. Spend 350 energy points to unlock advanced wound debridement and suturing, and open the surgical simulation space. Surgical simulation isn't all-powerful either. It took 2 hours to raise my wound debridement and suturing skill level to A+. Looks like reaching S rank isn't about time. It's about insight.
Dr. Lewis, suturing tools are ready. We can begin.
Okay, Lila. Then bring the patient in. Don't be nervous. Tell me, where are you hurt?
And here too. Okay,
Don't be nervous. I'll treat you right away.
doctor. Will these 2 spots leave scars?
There will be scars. Any wound can leave a scar. Even the best stitching can still leave scars. But, with proper stitching, the scars can be made much lighter, even hard to notice.
Really?
Most of the time. As long as wounds aren't too serious. If they're treated in time and don't get infected, it can usually be done.
Then what if I scar easily?
There is a way. We can use cosmetic suturing along with medication. That should minimize scarring as much as possible.
Really, doctor?
I can only do my best. But I can't guarantee a 100% result. If you can accept that, I can do the cosmetic suturing for you right now.
If you can't guarantee results, then forget it. Thank you, doctor. I'll check another hospital.
That's fine. Still, you need to get that wound treated right away. If you're going, try to go as early as you can.
Hey, you. Dr. Luke, you're just letting her leave?
Miss Lily. If the patient doesn't trust us, forcing treatment backfires. And besides,
Besides what?
and I have a feeling she'll come back.
How do you know?
Because in whole emergency department of Cloudflower City, the only ones who can do cosmetic sutures, besides are me. Plastic surgery may have that skill, but they can't handle a wound like this. Don't overthink it, Lily. Please send in the next patient.
The doctor at 3rd Hospital said the wound isn't big, just stitch it up. As for the burn, some physical therapy will do.
Dr. Rowan, I scar easily. Is there any way to keep this wound from leaving a scar?
What are you thinking? If there's a wound, there'll be a scar. Especially with an emergency room wound like yours. And you scar easily. The scarring will only be worse.
Isn't there some kind of cosmetic stitching? Wouldn't that work either?
Miss, that's a plastic surgery technique. And wounds like yours are something only we can treat. What we need to do in emergency surgery is stitch it up. Save your life, whether it looks good after. That's not part of our job.
I understand, doctor. Sorry. I still want to see a doctor at City General Hospital. He just told me. My wound can be stitched up. I'm leaving now.
City General Hospital? Isn't that old Chow? What nonsense. Even the treatment old Caleb gave them wasn't enough, and they still came to me. Isn't that just a waste of time?
Dr. Luke, you're amazing. In just a little while, you've seen 8 patients. Dr. Wade next door, the attending physician, has only seen 4. At your speed and technique, you're almost catching up to Professor Caleb.
Lily, you're giving me too much credit. Still far behind Professor Caleb.
Oh, stop being modest. But your prediction was off just now. That female patient still hasn't come over yet. You're buying me lunch at noon.
No problem.
Oh my god. You actually came back.
Dr. Lewis, I was out of line just now. Please don't be mad. I thought it over, and I still want you to stitch me up.
Alright, but like I said, I can't guarantee the scar will fade.
I understand.
Go get ready, Lily. After you go home, don't strain yourself, don't mess with it, and come back in 3 days for a dressing change. Come see me again in 5 days for the stitches out. After that, I'll give you some scar sheets.
Thank you, Dr. Luke.
You're welcome. Go back and get some good rest.
She came back. Luke, how did you know?
She cares about her skin and whether it'll scar. In Yunhua City, as far as the ER goes, the only ones skilled enough to do cosmetic stitching are Professor Cole and me. So she just went around comparing options. In the end, of course she came back here.
Impressive.
Luke, come and help. We've got a severely burned patient.
Where's Professor Cole?
Dr. Cole is treating a patient in shock, and Director Luke isn't in the department. The other senior doctors are busy saving other patients. You're the only one I could think of now.
Let's go. Patient is in shock. Blood pressure is very low. We need to start fluids. Lily, open up in 4 line and run the fluids wide open.
Luann, the patient's burned all over. Not a good spot anywhere. Where am I supposed to stick the needle?
Lily, can you get a peripheral line in?
In this condition, I can't find a vein at all.
Lily, get the head nurse. Have her come here.
We already got her when the patient first came in. She's still...
The other patients can't get through at all.
System. How much energy do I have left?
Detected previously collected high-frequency gratitude from patients, and shock and admiration from Susan Lee's high-frequency shock and admiration brought in a total of 100 energy points. Current balance, 130 points.
Redeem the basic intravenous puncture skill card.
Successfully redeemed the basic intravenous puncture skill card, plus 30
intravenous puncture
and a bonus of 30 minutes of surgical simulation time. Would the host like to start practicing now?
Practice.
Luan.
What do you think we should do?
Luan, no. I'd better go get Mr. Chow.
I'll do it.
Luan, stop messing. This is serious.
Yeah.
Lily, give me the needle. Let me try. After half an hour of simulation, my force skill is already up to grade A. Maybe Lily can't do it, but for me, it shouldn't be a problem.
Are you sure you can do this?
There's no better option right now.
Go find a catheter kit. A puncture alone won't fix the real problem.
Okay, I'll get it ready now.
Lily, I've already placed the patient's 4 line. Hook up the fluids and run them wide open.
Got it.
You're amazing. I still don't even know how to debride a wound, and you're already doing this much.
This is not the time for that. Debride the patient's wound now.
Just the two of us?
The patient can't wait longer. Otherwise, skin necrosis and eschar formation will lead to even worse consequences.
Dr. Liu, I'll fully cooperate with you.
I'm being called Dr. 2 now. Let's begin.
Okay. Dr. Chow.
Dr. Chow.
The injuries are this serious?
Dr. Chow. Thanks to Dr. Liu, otherwise we couldn't even have started the fluids. Dr. Liu not only opened 2 lines for the patient, but also cleaned and treated the wound. Thanks to Dr. Lucien, otherwise, the patient wouldn't have made it today.
You even learned this IV insertion as an intern. When the head nurse gets here, I bet she still won't do it more accurately than you. You handled it very well. The patient's vital signs have stabilized now. From here on, just focus on preventing infection.
Dr. Cole, go on with your work. We've got it covered here.
Dr. Cole, and us too.
All right, thanks for the hard work.
Man, while I was waiting for you, all the doctors and nurses in your ER were talking about you. I heard you saved a badly burned patient. Good for you.
I had no choice. I had to do it myself. I couldn't just stand by and do nothing.
From a human standpoint, there's nothing wrong with thinking that way. But when practicing medicine, that won't do. Many patients' conditions aren't clear, and if you act rashly without certainty, the consequences can be very serious.
I know. I have self-awareness for that. If I'm not sure, I won't do it.
As long as you know your limits.
Sister Lily, did the patient's condition change?
It's about a patient. But the patient isn't the problem. The patient's family is causing a scene here.
The family? Didn't the patient already?
Pull through. I'm trying to calm them down. Come back quickly.
Okay, I'm heading back now. Old Wade, I've still got something to do, so I'm leaving first.
Son, it's all Mom's fault. Mom didn't take good care of you.
Ma'am, don't worry. Your son is out of danger now.
But he's still so young, and now he's ended up like this. My life is really so hard. Son, it's all my fault. Son. Dr. Luke, you're the one who saved my son, right? Please, please help my child.
It's the patient from earlier, the one with severe burns. After seeing him,
You have to have a way to help my son recover.
Get up first. Don't do this. Your child has been saved now. The rest is a slow recovery. He's still young. It's not like there's no chance for him to recover through skin graft surgery.
Are you telling the truth, Dr. Luke?
It's true.
Son. Did you hear? The doctor said so. You mustn't give up, son.
Doctor. You really didn't lie to me?
You need to cooperate with the treatment. Focus on your treatment now. Recover well. Then we can repair later. If you don't cooperate now, there won't be another chance after this.
I'll cooperate. I'll do my best to cooperate. Thank you, Dr. Lucas.
Then get some good rest now. I'll come back and check on you later.
Leon, you shouldn't have said that. The patient's injuries cover over 55% of the body. It can't heal on its own, and a donor graft would be even harder.
I know. But you saw how it was back then. The patient and the family were both on the verge of falling apart. What we need to do now is calm them down, so we can keep the treatment going.
I know why you said that, but if the patient holds it against you later, it could affect you.
It's okay, Lily. As doctors, we need the courage to challenge the impossible. Nothing's wrong with protecting yourself, but only by being brave. Can we make the impossible possible?
Now I get why Dr. Carson likes you so much. You two have common ground. All right, enough. Get ready for shift handover. I heard Director Lucas is back, and there's a meeting tomorrow.
Okay, Lily. I'll definitely be there on time.
Yesterday, our city had a sudden public health emergency. As soon as I got the news, I took a flight back overnight. Yesterday, a total of 43 patients were transferred to our hospital, including 12 in critical condition. But, through our efforts, we successfully carried out the treatment. And here, I want to thank everyone for your hard work and dedication, especially Associate Chief Physician Warren June, who stayed at his post and worked on the front lines. He is truly a role model for all of us.
Doctor, you were the one involved in the emergency rescue yesterday. Dr. Warren is only suturing and cleaning wounds. Was Director Lewis wrong?
Well, let's talk about that later.
Of course, some of the younger doctors have done really well too, like the ones in our department. Dr. Ben Chen, Quinn Chen, Logan Luo. Wait for the new doctor. Luan did pretty well too. All right, everyone, take a break, then get back to work. I hope those comrades who were praised above will keep it up. Keep going.
What? Why are you unhappy?
With the way they're acting? It really got under my skin. I saw how calm you were, Doctor. I let it go, compared to that. I feel lucky I met a teacher as pure as you at First People's Hospital of Cloudglow City. That's what true medicine is.
Kid, you really do have a way with words. I chose not to argue or fight it and just face it calmly. I've never regretted that.
What I don't regret is everything I did to save my patients. As for the rest, it's out of my hands. But I believe what they're taking now, they'll pay back someday.
I've been a doctor for years, saved lives, healed the wounded, and seen too much of life and death. But I've learned one thing. In the end, what goes around comes around. Just do your best and you'll be rewarded.
Thank you, teacher.
All right. Go get ready. We've got a dispatch later. Come with me.
Got it.
Director Luke went too far at the meeting today. Dr. Wade and Charlie Bennett were just tag-alongs, but they got all the credit. You and Dr. Cole did the most work. But you were barely mentioned. It's so infuriating.
Yeah. I think it's way out of line too. If the workplace isn't fair, and rewards and punishment aren't handled clearly, problems will eventually come.
So you're just going to let it slide?
Right now, I'm a resident doctor. And I'm still an intern. All I can do now is work hard and wait until I have some say. Only then can I change anything. Alright, Sister Lily. Let's not talk about depressing stuff. Come on, let's talk about the patient's condition.
Okay.
It was just a false alarm. How come they're that old and still have such a bad temper? You got mad over mahjong that you passed out?
Seriously?
Dr. Landon, the TV station found the severely burned patient you saved. They know your name now, so they want to interview you.
Interview me? This is a chance to clear your name and Mr. Cole's.
Dr. Landon, don't be nervous. Now let's get started. Hello, Dr. Landon. You were still an intern on the job less than a month, and you acted without your attending physician's approval. What made you risk losing your chance to become a full doctor to treat this severely burned patient?
At that moment, the patient's condition didn't leave me another choice. If I hadn't stepped in, she might have died. As a doctor, out of reverence for life, I couldn't walk away in that situation.
We all know the patient's condition was extremely serious, but you were still a newly graduated medical student. In such a difficult case, many renowned doctors would have chosen to keep waiting or avoid it, but you moved forward without hesitation. We truly admire that.
I think that's because I was influenced by my mentor, Dr. Calvin Skybright. Teacher Skybright once said, "Every cause and effect has its return. As long as we do what we should do, something good will come." It was his words and example. He showed me what true medical integrity really means.
Dr. Lucas, you think highly of Dr. Theodore Cole.
Yes. Professor Cole has devoted his whole life to medicine. He asks for nothing else, never chases fame, and only wants to heal the sick and save lives. I asked Dr. Cole, after saving so many people and giving much, if he ever regretted still being just an attending physician. He said he never would. I'm the same as Professor Cole. We'll never regret doing everything we can to save our patients.
Certificate.
Someone collapsed.
Hey, young man, don't help him up. Your kindness could backfire. Yeah, handsome. Nowadays, you can't help people up. Exactly. Oh, man, you really can't help him up.
Thank you for your concern, but as a medical student, I can't just stand by.
Dr. Luke, is the person on this phone you? Dr. Luke, is the person on this phone you?
Yes, that's me.
Dr. Luke, your words about great doctors and sincere hearts were powerful. What you lifted up wasn't just an old man, but our conscience. What you saved wasn't just a patient, but the life of the whole medical field. Dear viewers, this interview with Dr. Lewis has shown me a ray of hope for the medical field. Here, I call on more medical workers to be like Dr. Lewis and be doctors who never live with regret. I'm leaving now.
Listen to this. What kind of nonsense is that? Isn't it just because he wasn't praised in public at the meeting?
Listen, what kind of nonsense is that?
Isn't it just because he wasn't praised in public at the meeting? He's already so eager to show himself off.
He dragged old Caleb into it. How am I supposed to face everyone in the department after this? Director Luke, please don't be angry. All this is temporary. Even if he's proud now, it won't last more than a few days.
Young people are passionate and think they can change everything. He should look at himself first.
If the hospital director didn't personally pick,
he wouldn't even have gotten through the hospital doors. I wonder if the hospital director
even knows about this. Well, you really did surprise me. What a pity. Still too idealistic. Great healers are sincere. These 4 words are easy to write, but hard to live by.
Mom, my job is pretty good now. It's stable, and nobody's picking on me.
Then take care of yourself. If life in the city gets too hard, come home.
Don't worry, I'm fine. Mom, let's stop here for today. You and Dad take care at home. Don't worry about me. Just look after my little brother and sister. So miserable. I almost cried. Rent day is coming again. I wonder if there's any cheap place near the hospital. Maybe I should post and ask around. Joyanne. Who's this?
I can record a video for you. If you need it, I can be your witness. Am I being too forward? Asking him to be my roommate. What if he thinks I like him? If we see each other every day, will we fall for each other over time?
You live near the hospital?
I'm a student at Yunhua Medical University. I live near your hospital and saw your post. So I came to ask.
Coincidence, we're in the same line of work. Send me your location tomorrow morning. I happen to be off tomorrow. If everything looks good, I'll just move in.
Take a look. If you don't mind sharing, you can stay in this room from now on.
For this rent, a place like this is a dream. Thanks, Joyanne. Otherwise, I'd still be stressing over finding a place.
It's okay. Then go ahead and settle in here. The system detected that the host saving a severely burned patient has had a wide impact. Career change option triggered.
Career change.
The host can switch to a burn and plastic surgeon. Once confirmed, the host will receive 1 S-rank burn and plastic surgery. Attention, once the host successfully changes careers, no other surgical career skills can be obtained later.
If I'd had a chance like this before, I might have taken it, but now I already have the system. I'd never make such a stupid choice. I, Luke and am going to be an undefined, all-around resident doctor.